Today we're going to talk about cardiovascular disease and various lipid factors. Cardiovascular disease includes heart attack and strokes, and these are the commonest causes of morbidity and mortality in our population. As we grow older, we all get some cholesterol deposit in our arteries. For example, if you look at the natural history of coronary artery disease, patients can have blockage of their coronary arteries, the main arteries that supply blood to the heart muscle. And these arteries can get blocked anywhere from 30 to 50 or 80 or 90%, depending upon various risk factors that we have to be concerned with. The most important risk factors that cause coronary artery disease or heart attacks and strokes include high cholesterol, high blood pressure, diabetes, and history of smoking. These are the four biggies. Unquestionably, there is some role of genetic factors in determining the levels of each of these factors. And of course, we can do a lot about smoking. But regardless of the genetic factors, there's a lot that can be done to prevent the heart disease and stroke by the control of all the risk factors that we are aware of. Now, this picture simply shows the LDL particle, or the particle that carries the cholesterol in our circulation. It's called low density lipoprotein cholesterol, or LDL cholesterol. It's a beautiful little particle if you look at it. It is not only just cholesterol that is in there in various forms. Some of it is free, some of it is combined with other fat particles. There's also a component of protein, but this is how the cholesterol dissolves in the blood and then circulates in our circulation and ultimately gets to the place where it may be deposited if it is present in excess. Here is a picture of the development of cholesterol plaque. Shown on the left, you can see there is a normal coronary artery through which the blood flows, as shown by the arrow. And over time, in most of us, as seen by this yellow plaque, the cholesterol tends to deposit in the wall of the coronary artery. The same phenomena takes place in the blood vessels going to the brain, or also in the blood vessels in the lower extremities, leading sometimes to poor circulation. This graph is just to show you the evolution of the cholesterol deposit in the form of plaques. So if you start with the normal coronary artery, you can see there is a little bit of yellow plaque developing even when we are relatively young. And as years go by, people develop enlargement of the plaque, and ultimately this plaque can reach a point where it can block most of the artery. One can see that here the opening or the lumen of the artery is narrowed quite a bit, such that patients can have symptoms such as angina or ultimately have a heart attack. In some cases, however, it is important to note that even when the artery is not totally occluded by the plaque, this plaque can actually rupture or break down, and that causes the blood clot to fill the whole arterial lumen, leading to sudden heart attack. Now, why does it happen, and what triggers this kind of event, even when the cholesterol is still not occupying most of the wall of the artery? That's where a phenomena called low-grade inflammation comes in. So when the cholesterol is deposited, depending on the other risk factors, this cholesterol deposit can get somewhat inflamed. And the risk factors that cause the inflammation of this plaque include things like uncontrolled diabetes or uncontrolled blood pressure or history of smoking. So in some of the patients who have poorly controlled diabetes or poorly controlled other risk factors, this plaque can rupture, and that can cause sudden heart attack even when the opening of the artery is still not fully closed. So this is a serious phenomena which we can address by controlling various risk factors that I mentioned. This picture shows the important role of another lipid particle called the HDL particle. One can see that in the circulation, these yellow particles are the LDL particles, which I mentioned before, which are responsible for the formation of the plaque. But at the same time, there's another particle called the high density lipoprotein particle, or HDL particle. HDL cholesterol is known as a protective factor because HDL particles tend to remove cholesterol from the arterial wall. However, it is important to keep in mind that the HDL is only important when the LDL cholesterol is high. If you lower the LDL cholesterol by, say, diet or medication, if the LDL cholesterol becomes quite low, then the HDL is not really required to remove the cholesterol from the arterial wall. So HDL is a very important factor in preventing the progression of the cholesterol plaque when the cholesterol levels are elevated or when there are multiple risk factors present. But most importantly, lowering the LDL cholesterol becomes the most important management issue in our patients, because if we can lower the LDL cholesterol quite significantly, then we may not have to worry about the HDL particle.